o'clock. There we go.
We've got the live button, Dr. Ovadia. It's you and I here today, Tuesday. How wonderful.
This is awesome. We are going to have another great conversation. Real excited to be here with you and for us to discuss lots of good topics around corporate wellness.
Great. Well, our title for today was Rethinking Wellness, and I love that, and it got me inspired, and I hope you'll indulge me for a couple seconds of I went back to, I've been in employee wellness, corporate wellness for many decades, and maybe if we're thinking about rethinking wellness, which is what we're doing here at Ovadia at Heart Health, is to think, well, what has it been historically? And I was fascinated. I got out my old textbooks as well, and some of my certification program materials. And actually, employee wellness has been around for a pretty long time. And if you go back even historically, some people say the father, and you probably know this, Dr. Ovadia, father of occupational medicine is a man named Bernardini Ramazzini, and I may have butchered the pronunciation of his beautiful Italian name. And that's back, we're talking the 17th century. And he was talking about ways to help employees stay healthier. So it's nothing new here. And then if we kind of fast forward, let's jump some things. Even in 1943, this is another little piece. Kaiser Permanente was building what we call the victory ships for World War II in a place called Richmond, California, where I actually happened to live at one point. And they were the first to make an on-site clinic right on site at the factory there in Richmond. They offered not only clinic service, medical services, but other additional things to help people. And they even had places they could live close by. So Kaiser Permanente, we know today as the big insurance company, but their beginnings were much different than that. And let's say digging a little bit deeper, if we come to the 50s, we have individual promoting high level wellness. And even, that was, started a lot of other companies starting to think more about just medical health, but really wellness. If we go a little bit farther, there was something called high level wellness. And again, I'm not trying to make a history tour here, but it's fascinating to think in the beginnings, we talked a lot about health and wellness, what we would call the more art side of it. Then in the 70s, we got more official worksite wellness programs. And then really in the 80s, when skyrocketing healthcare costs started to come about, we saw big changes in wellness, what we call more comprehensive wellness programs. And if we look at today, over 50% of companies that have 50 employees or more are doing some form of wellness. But then we have to think about, is it working? We've had these variations, right? Again, beginnings looking at just wellness, and we had historically companies even doing things to try to keep people involved in the company, keep them healthy, but even participate. They were building gyms and fitness centers. We have companies, having on-site clinics now. But the truth of the matter is, and you talk about this a lot, and I'll stop my historical journey here. Is it working, and are people getting healthier?
Yeah, and thanks for that historical reference. I really didn't know a lot about the history of workplace wellness. The way that I think about it, right, is this should be a natural sort of alignment of incentives, right? The companies are and should be incentivized to keep their employees healthy, right? And yes, we would love to think that's all altruistic, right? And the employer cares about their employees' well-being, but there are the practical financial realities, right? Of sick employees are going to be less productive, and they're going to be directly costing the employer money, here in the United States, because the vast majority of health insurance, for the working population, is the cost is being carried by the employer. And so, we see those economic incentives that should line up for employee wellness to be a big thing. And I think you asked, is it working, right? And I think we have to say, no, it's not working, in the same way that our healthcare system largely isn't working. And I think the reason for that is the same kind of thinking that is causing us to have so many problems within the healthcare system. And that is disease management versus proactive wellness, right? Managing people's illness tends to be the focus of the employee wellness or the workplace wellness programs that I generally see. And it's not focused on preventing and reversing disease in the same way that the healthcare system is not focused on preventing and reversing disease. It's more focused on the efficient management of disease. And again, as the employer looking at it from a mostly economic standpoint, what they're thinking of is, okay, how can I reduce some of the costs associated with these diseases that my employees have? And they're not thinking of, well, can I truly make my employees healthy? Can I help them to reverse the diseases? And that is where huge gains can be made. And so as we've been thinking about how to do this, right, and as we have started to partner with employers to institute these programs, that's really our main line of thought. What can we do to meaningfully impact, reverse, and prevent disease among the employees?
And you bring up two real key important components that are talked about within the literature in workplace wellness. The first being incentives, and then we talk about preventive. Especially in the 90s and the early 2000s, with the ACA, the Affordable Health Care Act, employers could, depending on what side we're 30% of the premium for healthcare could be tied to your participation in the program, which is a substantial amount of money. That went off the rails. You can even, Google, or I would say don't Google anymore, Grok, Penn State lawsuit, because the employees won a battle about the fact that they felt they were being penalized financially if they didn't want to participate in the wellness program, because 30% of your premium cost, that could be quite a lot of money. But incentives to want to be well, how do we, encourage that, right? Through engagement and empowerment in education. And I think at that point, that's where a lot of things went off the rails in employee wellness, is based on old science, maybe, eat less, move more. It's all about your total cholesterol number. We're going to give you what was then called the health risk assessment, which was, self-fulfilled, right? No one was checking it, but based on, primarily cholesterol numbers. And we've seen in just with normal people, you see this on a regular basis in with your heart patients, is that's not very good science to be basing your health on. But all of those metrics then were tied to the incentives. And this created also a lot of disillusion among many participants of, Maybe they lost the weight, but then they gained it back. Maybe cholesterol was not really their issue, but they tried to lower it because that's what helped them get their incentive in their program. So we have to make new incentives that maybe align with metabolic health. What do you think?
Yeah, definitely so. I think one of the sort of unfortunate things that has happened is because these programs in the past, didn't have the proper focuses, and therefore they didn't deliver great results for the employee or the employer. There's been sort of a negative connotation almost around employee wellness these days, and it's largely perceived as, a lot of employers are now looking at this and saying, well, why am I going to spend money on an employee wellness program when it's not going to benefit, us in the long run? And so changing that narrative, I think, is very important. And we can talk about some of the successes that we've seen with some of our programs, and we can point to other colleagues of ours that are having great success. I think about Tro Kalasian and his practice and what he's seeing in employee wellness that mirrors our experience. That when you go in with a program that actually works, and when you can get engagement, and this is certainly something that we should touch on, but when you can get engagement from the employees and they start to see the results, the employees, their health is improving, and that then translates on the back end to those benefits that the employer is ultimately looking for. And we've had great success in flipping that narrative. Maybe we can talk a little bit about one of the more recent programs that we started with a small, practice, a small dental practice that had great engagement and is already paying, some great dividends early on in the program. Why don't you talk a little bit about your experience with that recently, Krisna?
Absolutely. And I have the great pleasure of implementing our employee wellness programs for Ovadia Heart Health. And this small dental practice was ignited, let's say, and this often happens within not only employee programs, but one individual got some information about their own health, and they came to read your book, Stay Off My Operating Table, and start to sort of dig a little deeper into what could he do to improve his health, started listening to podcasts and came to us. And throughout this process now has inspired and started to engage his employees within this practice. And one of the key components for us of rethinking really employee wellness is this metabolic health focus. And there might be some listeners who don't even know what it is we're talking about. What is that? How is that different than disease management? In a nutshell, someone I like to make things simple. Disease management is just managing your disease, just simply as it's described, nothing beyond that, nothing preventative. Metabolic health focused is trying to improve the official 5 markers of metabolic health: your waist circumference, blood pressure, triglycerides, HDL, and blood glucose. That's the foundation there, but basically providing education. And we went on site to this small location, to the practice themselves with our fabulous Lisa Simmons, our nurse practitioner. And we got them, engaged. We were able to, Lisa Simmons, our nurse practitioner, walked through their labs with them. So they each had their labs in front of them. They could see what we were talking about within the lab work numbers. I worked with them on the various pieces that we focus on, the low carbohydrate, low sugar, whole foods nutrition, talking about exercise and the various components, looking at stress, sunshine. We also even had some exercise breakout sessions, but really giving them the tools, building their own toolbox to be able to feel independent. And at the end of the day, this is a big change. I think many employee wellness programs have focused with a top-down approach of this is what we're doing, this is what you need to do. We're coming from the ground up of this is what metabolic health and good metabolic health looks like. Here's the tools that can help you do that. And we're there as your coaches and your team to support you along the way. We're going to have individual coaching sessions with them, group coaching sessions, and just to see how excited this particular group has already started their own Facebook groups, sharing recipes, sharing emails on something that they're cooking. And that's really what we hope to build up is you have to take control of your health. You have to invest in your health. And when you've got a group support like this, the possibilities are really endless.
Yes. And again, what we're finding, right? The workplace is a great setting to implement these metabolic health focused improvements because you get that sort of team environment, right? And they start to work on it as a team. And you can even have some of that sort of competition that tends to go on. And then there's the other reality of, people spend a lot of time at work ultimately, right? It's usually going to be for most people, it's going to be where they spend the second most amount of time. For some people, maybe it's where they spend the most amount of time. And you have that support, that environment where everyone can support each other and you're making it a common goal. And this is another thing that we have found is predictive of success with these employee wellness programs is you need both the top, down sort of leadership that's invested in the program and also that, the ground up movement that people are excited about it and they're talking about it during their day and they're thinking about ways to, let's say, re-engineer the work environment to promote health, right? Changing the snacks that are in the break room or the kitchen, being able to do things like, go on walk breaks during the day as a group, maybe those types of habits that they can support each other with. And then, like you said, engaging in things like an online, group with your coworkers so that you can be discussing this outside of work. But what we love seeing is this is what becomes that sort of tradition. Everyone talks about the water cooler talk and what people talk about, during the day. And we want wellness to be at the forefront of those discussions that are going on in the workplace. And it's been amazing to see in a number of the workplace programs that we've done, seeing that grow as the program continues. What are some of the other key things that an employer might want to be thinking about as they're figuring out if an employee wellness program might be the right thing for them?
Well, just like we start within the private practice, and I do metabolic health coaching for your team, we start with the why. Why do you want to be healthy, and why would a company want their employees to be healthy is a great starting point. How does that connect also to your company cultural system? Even like some of the little anecdotes I shared historically, I think there was back in the early 1900s National Cash Register, the president used to invite company members to go horseback riding with him before work to engage in activity. We want to know what is important to the company's culture. we want to know also what's important to the individuals. For instance, something we made very simple in our initial talks with this smaller dental company is, what are your major health concerns? What are your major barriers? And thirdly, a little bit of that art. What are you interested in? What do you like to do? Do you hunt? Do you fish? Do you like reading, cooking, gardening? Because we want always to be tying into what the major health concerns are and how can we support you. But also, just like in exercise, what's the best exercise you're going to do? What's the best exercise? The one you will do, right? So if you're enjoying something and want to spend time on it, we want to be able to tap into that, and then starting to sort of build that program out from those things. But we always want to start with the why, and that's important for leaders to understand too, because why do they want to be healthy? If you're the leader of an organization, health should also be a priority, just as it is the health of your employees.
Amazing. Well, we, as I said, have been really focusing on employee wellness as part of our offerings. We have some great resources, and going to direct people to ovadiahearthealth.com/white paper. It's up there on the screen. That's going to allow you to download, I think we have 5 or 6 different white papers put together by Krisna, Jen, our coaching team, and our entire staff that are focused on employee wellness. And if you are an employer or an executive at a company and you're thinking that you may want to implement an employee wellness program, or if you're an employee and you want to encourage your executives to do this, I would say, a great first step would be downloading these white papers, getting the information, and then you can always set up a call to talk with our team about whether this might be a good option for you and your workplace. ifixhearts.com/talk is where you can set up a call to discuss our employee wellness programs. So great discussion. Any last thoughts to leave people with, Krisna?
Well, I think you brought up an interesting point about, we spend so much time at work. And I would say, maybe even since the early 2000s, there was, especially in Silicon Valley, the tech, it was all about having, the perks, the pool table, the ping pong, all these things, the dry cleaner and that. But where we see at the end of the day, time at work should also be helping empower individuals, not just having little cute things to try to keep them at work and keep them busy. And our programs are really about this metabolic health education, empowering individuals with the tools to help them achieve their goals, making it possible for them also to understand metabolically what's going on. A lot of individuals have an appointment that's 20 minutes long with their doctor. We have sessions where you can talk one-on-one with our nurse practitioner and really review your labs. I think it's a very unique situation that is more than just getting people to be entertained at work. It is really giving them the sense of independence and empowerment to take charge of their health.
That's what we're all about. Take charge of your health. Again, if you're interested in employee wellness, go to ovadiahearthealth.com/white paper, download the resources we have, and we would love to talk with you. You can set up that call again at ifixhearts.com/talk. So thank you, everyone who took some time out of your day to join us for this, whether you're watching it live or the recordings. And we do these live streams at least once or twice a week. So make sure you subscribe to whatever channels you're watching this on, so that you'll get notified when the next one is coming up.
And the next one is Monday, this coming Monday, with longtime low carb advocate Amy Berger. And we're excited about that. That'll be Monday at 5:30 p.m. Eastern time. and love to hear from all of you. Thank you for the opportunity.